What do changes in stool consistency mean for colon health? Imagine your bowel habits as a window into your digestive system. Small changes in how your stool looks and feels can tell you a lot about your colon health. Understanding what these changes mean can help you catch potential issues early. Stool consistency is usually described on a scale called the Bristol Stool Chart, which ranges from hard, lumpy stools to watery, loose stools. Hard, lumpy stools, which are classified as types 1 and 2, often indicate constipation. This happens when stool stays in the colon too long, causing the colon to absorb too much water, making the stool hard and difficult to pass. Causes can include low fiber intake, dehydration, or slow bowel movements. While hard stools themselves are not directly linked to colon cancer, chronic constipation can sometimes signal underlying problems like poor colon motility, which may need medical attention. On the other hand, normal, smooth, sausage-shaped stools, types 3 and 4, are signs of healthy bowel function. These indicate that your colon is moving waste efficiently, and your diet and hydration levels are likely balanced. These stools are easy to pass and suggest good colon health. Soft, loose, or watery stools, classified as types 5 to 7, often point to diarrhea. This can happen due to infections, inflammation, or irritants in the digestive system. Persistent diarrhea can lead to dehydration and electrolyte imbalances, and from a colon health perspective, it may be a sign of inflammation or other conditions that need medical evaluation. Changes in stool consistency can also serve as early warning signs of more serious issues. For example, if you notice a sudden shift from normal to hard or loose stools that last 4 weeks, it could be a sign of a problem like a blockage, narrowing, or growths in the colon. Hard, persistent constipation might suggest a tumor or polyp blocking part of the colon, while ongoing diarrhea could indicate inflammation or irritation of the colon lining. It is important to consider stool consistency, along with how often you have bowel movements. Studies show that infrequent hard stools are linked to higher risks of overall mortality, while soft stools at low frequency may be associated with increased risks of cancer and heart disease. If you notice blood in your stool, unexplained weight loss, abdominal pain, or a feeling of incomplete evacuation, these symptoms should prompt you to see a healthcare professional promptly. Maintaining a diet high in fiber, staying well hydrated, and exercising regularly support healthy stool consistency and colon function. Monitoring your bowel habits and noting any persistent changes can help you identify early signs of potential problems. Remember, every person is different, and what is normal for one person may not be for another. If you experience ongoing or significant changes in your stool, consult a healthcare provider for proper diagnosis and guidance. In summary, changes in stool consistency are more than just a nuisance. They can reflect how well your colon is functioning and may signal benign issues or more serious conditions like colorectal cancer. Paying attention to these signs and seeking medical advice when needed is an important step in maintaining your colon health and catching problems early.